4. Hopefully we get out here by 11:10. There's not a whole lot of stuff that you need to know about radiology that's going to be on your test. It's going to be light. Are you switching or I'm switching? I can switch. Yeah. I'm going to like mess it up and go whatever. You want me to say next or that work for you? Okay. My name is Chief Spurgeon. I've been in the Navy for 18 years. I started out as a line corpsman with 1st Marine Division for 4 years. And then I was Tampa, came back, Foreman Mick Pond, and he's like, hey man, you got to do another job. And I was like, hey man, I want to do another job. And so lucky I ran into X-ray tech and said, you should do X-ray. And I was like, cool, they got a job when they get done. So I became X-ray tech, and then I went to North Carolina, and then I went to Special Operations Command, and then I went to United States Capitol Building for Congress and worked for them. And then went to 1st Medical Battalion, and then now I'm over here as an X-ray Phase 2 instructor. So if there was a place that I wanted to go, I didn't want to do the same thing. I was like, that'd be cool. I never did that before. So thank God the Navy has always offered me something different to do. I've always been lucky enough to do that. Never been lucky enough to go outside of America unless it was a combat deployment. So I'm envious of anybody who gets to go to Asia or Japan. That's really where I wanted to go, and I didn't want to come here 100%. I did that same thing, like, you know, fill out what you want, tell everything about you, you know, how many teeth you lost as a kid. Did that, and I had Texas and Virginia, and they said you're going to Virginia, and I was pissed off for about 11 months. So because Neil wanted to retire in Texas, PRN, and go straight. I had a Navy pay for the last 3 years in my house. And then I'm golden, right? Well, somebody must have knew my name and said, not today, Satan. So now I'm over here, and I'm going to get you through this X-ray, okay? It's not going to be hard. Some of the stuff we can put into Notion. So general diagnostic radiology is what they normally do. It's just going to be bones. So in general, diagnostic is always general, okay? And then computed tomography is a fancy X-ray machine. So you have a tube head for X-ray going to here, and then when you're doing CT, you can't see it, but there's plenty of tubes all the way in there. And then so the tube turns around you like this. You can hear it wind up, and it's constantly taking images all the way around. So that's computed tomography. MRI, the first two are ionizing radiation, okay? MRI, magnetic resonance technology, is radio frequency caused by magnets. It's a pulse that'll knock down your atoms, and then depending on how fast they come back is what the image is going to look like. So if we hit them really fast, the image is going to come back slow, and we can saturate like the fat, and that'll knock all the fat out. It'll come out what they call a T1 image. We can leave the fat there, go slower, and that's called a T2 image. And then one is general anatomy, and T2 is for diagnosis if something's wrong. If you have like any type of tumor or cancer or growth, or it needs to be something wrong in your organs. Cardiovascular interventional technologists, if you guys went to the career fair, you saw a couple of these guys up there. It's just a fluoroscopy that they're going to do if you have any parents that have to have a stent or anything put in. So if your vessel is closed down, then they're going to go in there guided, and they're going to put the stent in there. It's like a balloon or a wire, and then it's going to open the vein just like this, so the blood can go through. Sometimes they have like a net in there that's going to catch clots as well, or help break it up so it can go through your body and won't stop and cause a traffic jam. Nuclear medicine uses radiopharmaceuticals, and they have, if you get those, like you have to have a card, you have to like stay in a room. It's like getting COVID. If anybody gets next to you, then they could be radioactive. So you have a hot room that you have to sit in to get it, and then you get your procedure done, and it lights up. The only thing bad about this process is if you have like a stress fracture, a lot of times where your stress fracture is at, because you cannot see it on other imaging, it's going to stay lit for a long time. So if we wait, we come back, it's still going to be lit, and it looks like you're still going to have a stress fracture, but it's probably already healed. It's just a latent effect, which means it's an after effect of the nucleotides. And then if you're going to Marine Corps base, the alarm is going to sound off because you're going to activate the alarms. Sonography or ultrasound uses sound waves, which is really awesome. It's like a sonar. The hardest thing is you're looking at an image, black and white, looks like a clouded TV that doesn't have any color, and so you have to be very good with your anatomy. And then mammo, just another x-ray, switch the breast, get a picture, and I think now they have digital. You want to pass something to me? Okay. All right, I'll have my phone on me. Thanks, Mr. D. And then oral radiography. Hopefully our other guy comes back. We all done that. It's annoying to me having to open up my mouth, stick that thing in there, that dries out. It feels weird and funky. I don't like it. All right, next. So those are just stuff that's just like, hey, you should be able to see the word and recognize it, just those short terms. You guys get all these slides, right? Yeah. So everything in red is what you need to know. What I always tell when I was teaching for the first class, don't memorize, be familiar. What is it familiar about something that you can remember, okay? So the date's not going to change for this. 1895 for Wilhelm Conrad Roentgen. Hey, they're not going to change that name, man. If a German name comes up there, that's who it's going to be. You can't mess that up, right? And the other guy is Dr. Odo Walkoff. Like, he didn't like the dentist, so he walked off, and that's dental radiography. So, like, that's how you got to put stuff to it, right? So then, X-ray. Oh, I'm sorry. The Crooks tube is what we started out with, right? That's the very first tube. So those are probably 3 questions that you get right there. Crazy how they just pull the little bitty stuff that you can just pass over. That's what they're going to use. Wavelengths. Okay, so radio graphs use really small wavelengths that can penetrate your body. They go the speed of light, and it's easy penetrable to go through your body. So that's all I care about on that one. And if you want to care more and memorize everything, I saw, hey, what's your name? I can't see if you're on. I have glasses on. Carlson. Carlson has 2 warfare devices. Anybody else have 2 warfare devices? That automatically caught my eye when she walked up. Hey, Carlson, you had to memorize that whole book, huh? Yeah, that's the one thing you got to memorize is a warfare device. A Navy test, yeah, you got to memorize all that stuff back there. I can see that one. A Navy test, hell no. Recognize it. Go over it enough times where you can recognize it. Or they had a couple of things up here that said when your static zone, I know is in front of my stuff, you pass cool things behind you, and if you're going to assist, you're going to be on the right and left. I got that. Sometimes I can remember stuff, but what cool stuff can I put to that walk-off, man? Piss on that guy. I'm walking out of here. That guy did dentistry, right? 1895 was the first guy. I don't know what his first name is, but I remember walk off because I put that memorization to my head. So whatever cool words that you can put to that, that's how you're going to survive on these tests. I know, man, because like I think I took. Anyway, when I made 3rd class, I literally just had to put my name on the test because war was going down. You got so many awards, it's unreal. 2nd class, geez Louise. Okay, I probably took that one 7 times. I know damn well I took the 1st class 7 times. But I finally got it hooked, right? When I learned how to study, I was just going in there. You know, I'd have a study group and all I did was talk because I like talking. And I didn't get away with anything. So, but then, you know, I had to buckle down and like I learned that you got more money if you actually studied and paid. So like money talked and I wanted more of it. So I got better at it. But then I learned these little tricks for taking it. Okay, so you're going to see this right here. The one thing I don't like about this, remember the V has to be capitalized. So lowercase k, lowercase p with a capital V. They're going to write that 4 different ways, right? But that's the one way to remember it. Kilovoltage peak. That's the way you write it. The next one is exposure time. So exposure time multiplied by milliamperage is mass. So it's going to be lowercase m, capital A, lowercase s. That's not on there, but they're going to show that. That's how it's going to be. You're going to get to that test, and it's going to be a capital M, lowercase s, capital S. Any way you can think of it differently, but this is the only way to remember it, because that's the easy way to trick your mind, right? The only way. There was a question on my test the other day that said, which is a palpable bone in the body? Your iliac crest, your ASIS, your greater trochanter, or your femoral neck? Or your symphysis pubis. All right, does everybody know where your symphysis pubis is at? The bottom of your pelvis. You are going to get kicked out and get sexual assault charges if you got to touch somebody's symphysis pubis, right? But you can touch it. So the first answer I picked was symphysis pubis because you're not supposed to touch it. But I went back and read the question, which is not palpable? The femoral neck. of all those bones, you cannot touch the femoral neck. So my brain shot off quick. That's a no-no zone. Not going to touch it. That's the answer. Nope. Slow down our minds and read the question. Ah, damn, got that wrong. That was stupid. I can't touch the femoral neck, right? The person's got to be dead or a skeleton in order for me to touch that neck. So remember that. Slow down when you read those questions. So kilovoltage peak, capital V, mass, capital A. All right, what's the next one? Okay, so the target, let's see. So safety is everyone's responsibility, no matter what, who you are. The three-way to protect yourself is time, distance, and shielding. So the time that you're in the area of radiography, the distance, you have to be 6 feet away, and the shielding, stand behind somebody or a lead wall or a barrier, okay? And then ALARA is definitely going to be on there, as low as reasonably achievable. Whatever, it's all going to sound the same. There's 4 of them, they're going to look just like this, okay? And it's only this one right here. That's going to be on there. And it's the same thing to reduce it is time, distance, and shielding. Time, distance, and shielding is everyone's responsibility and as low as reasonably achievable, okay? Let's see, so X-ray only really affects the reproduction organs for males and females, and the breast tissue. Because those things are constantly dividing, that's where radiation takes its most hurt to. So that's where you want to make sure people are covered up. Go for it.
Pay attention to the one in parentheses right here, because it's usually on the test talking about the thyroid collar, right? So it says protecting reproductive organs and the thyroid glands. So the only time you're not using the thyroid collar would be on the panoramic X-ray.
And that's going to be up here, because like I don't do panoramic, but he does. I mean, like, I take my iPhone, but there's no radiation. He just validated me. Every time I make a joke, and it's not that funny, but somebody laughs, I feel good on the inside, like I just got 1 heart or like 1 like. And my wife tells me that you validated me, so that's cool. I love that. And she also says I'm the funniest person that I know. I know me very well, and I think the same thing. So I'm happy. But that's good. I'm glad you pulled it out. So what's your name?
H1 Stanway.
Stanway? Stanway's been doing a great job, man. Like, the stuff, if he was my instructor and I was taking this, I'd know a lot better on my test. Those little things that he showed you that you can remember without having to memorize the whole damn exam is awesome. I can remember all his little tricks and trades. But thank God I don't take this test anymore, man. I've like 20-something times. I'm tired of it. Okay, so the next is the dosimeter. And that's to measure the radiation, right? If it's not dosimeter, it's going to be Tango, Lima, Delta. Okay, that was speaking Marine right there, because I didn't know if the Marines spoke normal language in a group. But that is TLD if you're in the Navy, all right? So that's another way to say it, TLD or dosimeter. They're interchangeable, and it's not in your book, but they can still use it that way, okay? Every 6 to 7 weeks, they got to change it. And then REM. REM is definitely going to be on there. Radiological equivalent to man or mammal. They will change that. They're going to be up there, and it's going to say man, and I guarantee you one of them's going to say mammal. And just like any test you go to, it's like 2 of them are stupid, and 2 of them are just alike. And then the Navy's going to say, you got that wrong. You should have picked the one that was more right. And you're like...
Speaking of more right, I want you to pay attention to the wording on this last bullet point. Non-radiation workers is 500 mREMs, because you're about to hit another slide where it's talking about actual radiation workers and what their limit is.
Right, so you have non-radiation workers, people that don't, I think it's public, and then you have radiation workers like myself that can also be people who work in the nuclear propulsion ships or submarines as well, okay? So that's who that's going to count for. So non-radiation workers have to have can only have 500 millirem per year or 5 millisieverts a year. So you have the big S in the middle, right? So if they try to trick you, just go the big S in the middle. You'll be okay. All right, next. Who cares? Just never stay away from it. You know, it's not like never keep. You guys know that one? Yeah, it sticks with you for life, right? Never. Just remember that. Okay, what is that? Is that the National Radiological Commission?
Yes.
Okay, so National Radiological Commission, they're interchangeable, right? They're going to think you know NRC, but then it comes up there and you never see NRC, but you see National Radiological Commission. It's like, God dang, what does NRC stand for? Because you never memorized what it stood for. Just remember NRC. That's happened to me before. I was like,
That's a test question. They'll say who establishes the whole body doses for radiation workers, and know
Yep.
your NRC.
man, you're a cool assistant. All right, and then this is the other two where it says Title 10, Part 20 of the Code of Federal Regulations. So 10 CFR Part 20, it could be either way, whichever it is. Because you remember, if you haven't learned, whatever the longest answer is, that's going to be your answer. Because why the hell would somebody write something that long over there? Like, hey, like, this is the answer right here. So, all right, we can't get any better than that. All right, exposure to radiation. No, you're good. You go back. I'm sorry, we're tricking each other here. Go back one. Go ahead.
So this is the radiation workers, right? Your non-radiation was 500. Your actual guys that are working with it every day, it's 5,000. Again, what I talked about, why do you think the radiation health manual is a 5,000 here instead of a 6,000? Because it's the admin and how you run the program itself, not the actual x-ray stuff happening on the day-to-day. So it's funding under the 5,000 instead of the 6,000s.
I just learned that today. That was never a thing for me. If it didn't have it exactly, I would have got it wrong. And then, of course, the P5055, that's the RAD Health Manual. That'll be on there, too. Or they'll say, hey, what's the P5055 or the P56 or P54 or P53? You know they're going to try to screw you up like that. All right, that's the next one. All right, so if you have too much radiation, this is what can happen. Now, this stuff is not automatic. These can be latent effects. So if you have cancer and you're getting radiation, this can happen to you. If you don't like what somebody says and you go to one hospital after another to get a chest x-ray or a CT, because you can't get a CT, you have to have 24 hours apart. Well, if you never got a CT from me, then I don't know, and if I ask you and you lie to me, then I'm going to keep on scanning you. And this is what can happen. All these things can happen. We never know. Everybody is born with the cancer gene in their body, and we don't know what it takes to mutate that gene into cancer. It could be this radiation, and we get it everywhere. We're walking out in the sun, we're up in the mountaintops, and we're going in the airports. What was it? Planes? Yeah, everywhere. It's all in there, so you never can tell where it's going to happen. Except in California. Everything causes cancer in California. In and out causes cancer. All right? Just letting you know. All right, so these are the instructions. Precious metal, I have no idea why we had that on there. I don't even know if we still do precious metals.
We do.
Okay.
So that one, so I'm going to make it make sense to y'all, right? 4,000
Nice.
4,000 series is what? Logistics, right? Okay, so precious metals, if you work in the dental lab, you're going to be working with gold and other things, right? So they do this gold report that they have to submit every month, which is literal gold, right? And gold equates to what? Money, right? So gold and taking care of the precious metals within that program, because the gold is precious, is falling under the 4,000 series. These other two, like I said, are obsolete because the 6220.9 alpha and the 6600.10 combine together to make your 6220.9 Bravo, which is your healthcare associated infection control instruction.
Hey, how come they just don't use silver in dental? Is it cheaper?
So they use amalgam for stronger fillings because it's a more durable material. And then gold restorations are just if maybe they want to look pretty in the back or whatever else, or if it's personal preference. But amalgam is usually the standard choice for your back teeth because it has more durability.
What about, can they just do that with porcelain?
So they could, but porcelain's not as durable. That's why you only
Okay.
see your porcelain on your facial. One, because it's more aesthetic and it's more porous, meaning it's easier to break down than the actual mercury material that makes up the amalgam.
So, do you guys actually have like gold in that you opt in?
Yep.
Do you guys know where to keep it?
I'm not a dental lab tech, but that's why they have to do that gold report and send it to the CO every month, is because they're keeping that.
So they treat that just like the narcotics that you may have in your clinic or whatever, accountability.
Yep.
All right, interesting. Yeah, now that I know, I'm X-ray tech at Mango Dental. I'd like to buy my wife a new ring. Maybe I'd drop off some gold.
Act like X-ray techs don't make a crap ton of money on the outside already, because they make some money.
Yeah. I do CT, MR, and X-ray, so it's pretty handy. So there was the person that got me into that. There was a P-way with a bunch of hatches down it. That's the only Navy thing I can say. If I've never been Navy, I've always been with Marines. This is my first Navy command, so That's why, like, there's so many different doors you can go down in, and that's why I chose it. And then once you get certified in it, the Navy's got a program now to where, I think at your rank, if you go in as an X-ray tech, after 2 duty stations, you can drop that NEC and then go to another duty station. So nobody wants to be in the military anymore, right? So we gotta do things, not us. Big Navy's gotta do things to get more people to come into it. So it's either money or, hey, come inside, get an X-ray tech, get your national certification, drop it, go do something else that make rank quick, or which is, make rank quick means go out to sea as many times as possible. I like to swim in a pool, not in the ocean. I like to walk out in the daylight. I don't want to have to wait for a damn airplanes to stop rotating up, and I don't like living in red lights. So that took all of it out for me. But the one thing I want to say is when you guys are on here, pass your little tricks like he does, those little words like, hey, stomp, clap, clap, elbow slap. That's what's on there. Walk off if you didn't like the X-ray in 1895, and then 10 years later, like 1905, I think it became more prevalent. They started doing other things. Too much radiation is a bad thing. Never stand in the way to it. Never hold a cassette, and never chew bubble gum and run at the same time because you bite your tongue. But I saw you smiling, man, so that's good. But anyway, share what you have in here. If you got some cool memes or numbers or whatnot, share those numbers, share those ditties, and then that way you'll know it. Whatever. It's always easy to remember something funny when you do something, or just those little words that you can remember. If you can remember the one word and it leads you to what it actually is, you'll be able to connect it. But you may suck at speed dating, but you'll be really good at a military test. And so that's the most important thing, because that pays the best, right? And then since they changed the schedule about when you can it gets harder and harder, like to get up the chain unless you get mapped, okay? And that doesn't mean you draw a map, but that means like you did advanced, so that's cool. I didn't get anything on that one, but.
Can I have somebody come up here as a patient real quick so I can show you?
I'll be a patient.
I want to break this down Barney style for y'all for dental. These next 2 slides. All right, so you're always wondering what the hell paralleling and bisecting angle is, right? So he's my patient. I have my tube head over here for my X-ray, right? So paralleling, I want you to see this word here. It has a paralleling device. Our paralleling device is a bite wing frame or an X-ray frame with an aiming ring, right? So what I'm going to do is I'm going to put the bite wing in his mouth right here, and I'm basically lining up the tube head with the aiming ring to where they are parallel with each other, so I have a straight on image of that tooth. There's no overlapping, there's no elongation, it is straight on the tooth.
Still gonna come.
Right? So we call that training wheels, right? We call that training wheels for our dental techs that don't know how to really take x-rays, right? So that paralleling device, notice 16 inches, right? So the long axis of the tooth using the locator ring, indicator rod, and the bite block, right? Now, when a paralleling device is not available, meaning we don't have a ring, what we'll do is we'll just take that sensor, pop it in the patient's mouth, and we're going to bisect the angle. What does bi mean? 2. So it's 2 different angles intersecting with each other. So I'm taking the angle of the tube head and matching it up with the angle of the sensor to where I have an image straight on there, and again, no overlapping or elongation, right? So when paralleling devices are not available, it's bisecting. And your number there is going to be 8 inches, right? So it's talking about the distance, right? But 16 inches, if you think, the ring is all the way back here, so I have to be further away from the patient. With bisecting angle, I can be right up next to the face because there's nothing interfering with that to get the 8 inches. Okay, and then now for landmarks, we'll go to the next slide. And let me scroll down here for these guys for the next slide. They're online. All right, so we're talking about landmarks. I know you guys have seen this on the test, right? So vertical, what does that mean? Up and down, right? So if I have the tube head, vertical angulation, why does that matter? Okay, so on a bite wing, I don't want vertical angulation because that means it's going to elongate the tooth and distort the image. Now, if I'm taking a PA, meaning I want to see the apex of the tooth and what's going on there, I'm going to vertically angulate that up for an anterior tooth so I can see the full apex of the tooth. And I'm going to go down all the way below if I'm trying to get an apex of the tooth on the bottom teeth, right? So up and down is vertical angulation. Horizontal angulation is side to side. So for the bite wings, if I'm off on my horizontal angulation, I'm going to cause overlapping, meaning I cannot see that single tooth. It's going to be overlapping on the image of the next tooth next to it. Right? Or vertical up and down, horizontal left to right. Okay? Now your landmarks. So we're talking about maxillary. So we're going to go incisors to the tip of the nose, right? Because all our tip of the nose is right here. Guess what? All our incisors are right underneath the tip of the nose. Okay? So the landmark is going to be right there for a maxillary. Okay? Cuspids, right? So our cuspids are right by the ala of the nose. And the ala nose is right on the outside of the nose right here, which lines up right with our canines, right? Which are our cuspids. Okay? Our bicuspids is below the pupil of the eye. See the eye right here? This is where your premolars are, right? It literally lines up exactly where your premolars are in your face. Okay? Through mandibular, right? So this was maxillary, just going by the ways your face are. Mandibular, incisors, right? So this is my chin. Guess what? My first 4 incisors are right here, right above my chin. Your cuspids, right? Know these inches, right? 2 1/4 inches above the lower border of the mandible. So you have your mandible right here, right? This whole bone right here. So if you spread out, 2 1/4 inches above the lower border is your cuspids. 3 1/4 inches, so a little further out, is going to be your bicuspids. And then molars are directly below 1/4 inches above the lower border of the mandible. So because the mandible kind of curves in, it's going to be a shorter distance with your 1/4 inch, right?
How does that work when people have like overbites and underbites? Is it the same?
It's still there. So the overbite underbite is not going to affect the landmarks on your face, right? Because you still have your jaw there. It's just because your teeth are still staying in place. It's just your jaw length is either going to be out or closer, right? Now, what was I going to hit on? So the PAs, right? So what I'm talking about is when they're taking a panoramic, or not panoramic, but a periapical image, right? So no, a PA is different from Pano. Pano is a full mouth series, which by the way, it's not on here, but on the test, I think it's a 16, it's 8 or 16, I'll look it up for you guys, set series for an actual panoramic x-ray. You're going to be looking at either you're going to angulate the tube head up like this, or you're going to angulate it down, right? Because that's the only true way to capture further in to see that apex of the tooth, right? And that's where we're going to see dark shades of any breakthroughs, or where we're going to see that grape that we talked about, right? What was the grape an indicator for? Periapical abscess, right? Does that help make sense?
Yeah.
And then the last dental slide, I'm going to tell you right now, don't worry about dark rooms because we don't do those anymore. It's not early 2000s anymore. We use digital or automatic film or digital radiography, right? But automatic film processors are the most common, right? Anytime you see most common in an instruction, I would probably put a star next to it. So most commonly used in dentistry is automatic film processors. All right, and that is it.
Do a quick turnaround, 12 o'clock.